name's Peter Thomson. I am 61 years of age, and my left knee has been bothering me for about 6 months, and it's gotten progressively worse. I did the typical things you do. You start taking Advil, and once I realized I was living on Advil, I went to the doctor. They shot it up with cortisone, I believe, and that seemed to help it for a couple weeks, and it seemed to get worse. Went back, and they said, hey, now it's time for the scope. And at that point, I really, because I knew that once you get a scope, you're more apt to get a knee replacement. And once you get the knee replacement, you're going to get the hip replacement because one leg is shorter than the other. I really started looking for alternatives, and I went to the seminar that Atlas Medical Center had, and I did some additional research. And I got to tell you, this is what I believe is going to be, it's the best option for me because it doesn't involve surgery. And like the team at Atlas says, the worst that can happen is it doesn't work. But the odds on this working are very good, and so I'm looking forward to the results. My activity in life has really been limited. I would say over the last 6 weeks, especially. I'm not working out. I like to work out, so I haven't been able to do that. I have to, when I get up, I have to, get my bearings, or else I'll, if I have a sudden movement, I can have sharp pain. And it's been an issue. It's been an issue. I can control the pain if I take the heavy duty. I guess it's like a Motrin prescription I got from my GP. But it's not giving me the quality of life that I want. I'd really like my knee to be back the way it was. Yeah, it was easy. Little sting when I think it was lidocaine they used to deaden the area, but other than that. No pain, and I got to tell you, I don't know. I mean, I wasn't expecting this, but I'm like, my knee pain's gone. So you feel a little fullness in the knee, I guess, because they're injecting the stem cells, but they tell you to move it around. But like normally when I would stand up, I have to get my bearings, and well, let me just wow. I mean,
you already notice.
Yeah. I guess that doesn't happen with everybody, but it's happening with me right now, and I'm very happy.
Well, we're excited you're happy.
But I would say for anybody who has concerns about the bone marrow part of it, it's easy. It's there's no pain. It's over. I think the whole procedure, including my knee, injecting into my knee, was done in about 15, 20 minutes. And the bone marrow part of it was done in probably 5. There was more prep time, getting everything ready, and it's very professionally done. Probably 10 minutes of prep time, 5 minutes in the procedure, and then you're done with that. And then into the knee, and then you're doing some the knee bends, and they tell you to move it around just to to get the fluid distributed. But yeah, I'm pleased.